thank you to everyone who's joining us again. I see some familiar faces from our previous webinars, and we're really excited to be back partnering with ELGL. One of the things that we keep coming back to in these webinars is just what an unprecedented time this really is, which I know sounds very cliche at this point. But with that, we're all still figuring out how to navigate this together. And I'm really excited to have three women from very different governments and very different agencies and very different parts of the country who are wrestling with some of these questions. We all know that we are living in a time where faith in institutions, broadly speaking, is kind of at an all-time low. Everyone is an expert or thinks they're an expert. Very few people trust experts. And I think that particularly as local leaders, there's a self-awareness required there in recognizing that at least part of the reason for that is that people do realize that they have an attachment, they have awareness, they have sort of a knowledge of their own community that often we haven't tapped into, especially over the last half century. As local government has become more professional, we've occasionally forgotten that policy needs to be connected to the culture of the community in which we're working, and to the values and priorities of residents. That puts us at a really difficult place. Our mission at the Davenport Institute is to help build stronger communities by promoting really genuine, authentic, inclusive public participation in local government, to help residents engage with each other across differences as well as with government, so that we're really encouraging people to wrestle with difficult trade-offs and come up sometimes with even creative solutions that we may not come up with on our own. But this moment is really tricky. This is just a difficult moment. There's knowledge that's coming from sometimes further up at the state level or even the national level that we're just conveying to our residents. There's decisions that are being guided by public health information that's changing really constantly. So on the one hand, local governments are communicating out, as Kirsten was noting before. But on the other hand, we still need to figure out how to engage with residents, particularly as we begin moving toward reopening. And so one of the things that I want to just throw out there, we have, again, none of us, we're all figuring out what we're doing, but I'm just interested in hearing from each of our panelists what the biggest challenges have been to having productive conversations about either ongoing closure or beginning to think about reopening in your community. And I'm just completely in alphabetical order going to start with Brianna, and then we'll just invite a conversation between the three of you about what are the biggest challenges to productive conversation when you're looking at connecting with your community around these issues.
Sure, Ashley, that's a really important question and something we've been struggling here in Amherst. And just a little bit about our community quickly. We're rather small, approximately 40,000 community members, but we are the host to the flagship university for Massachusetts, as well as 2 other colleges. So a little over half of our population are student community members. So we've got this kind of push and pull of different interests that has, and I hate the term full-time residents versus kind of the college students, but there's a push and pull of interests there that have kind of been a hurdle in all of our conversations. And then our business community and our senior community, there seems to be a lot of push and pull there in terms of priority and safety. The other piece is when we are engaging and seeking participation or input or suggestions from our community members, we aren't always able to execute or implement their suggestions, which has been a problem. Sometimes state or federal regulations trump what we would maybe like to do and vice versa. So there's that piece of potential dissatisfaction if the ideas that they've contributed they may not see them in action in our community because we're just not able to at this time. So that's been a big one for us, is trying to set the expectations that we value input and ideas and suggestions, but we might not always be able to implement them, at least at this stage of the crisis and the pandemic. So those are kind of the 2 major themes, just lots of different priorities and different segments of our community, and prioritizing and triaging those, and then the expectation settings for the engagement.
Yeah, I want us to come back, especially to that second piece of when your hands are tied and yet you're communicating back to people. But I want to hear from Jennifer and then Maureen first, and then we'll kind of open that up. I'm guessing maybe some similar things, but maybe some different ones as well.
Yes, absolutely. We are similar. I'm coming from Denton County Public Health. Denton County is a county in North Texas with just over 40 cities and towns and approximately 900,000 residents. We do have 2 large universities, one of which has almost 40,000 students, and in our county seat. So we do have that same pool of permanent residents and our students who come and go. Some of our biggest challenges throughout this in public health is relaying the information as quickly as possible. We've tried to be as proactive as possible, but our boss is our director has been incredible at reiterating the fact that we do feel like we're building a race car in the middle of the race. We are responding, and as Brianna shared, we do take those community suggestions and the feedback as a goal. We want to use the feedback that's provided. We want to be able to make new priorities with it. We have a statistics website where we have built from the ground up since March, but to utilize the community's suggestions and what they want to see, what the numbers that they want to see in balancing patient privacy and health information, and all of that is very delicate balance in public health, while also trying to provide as much transparency as possible.
Maureen, what about over in Morgan Hill?
Good morning, everybody. So Morgan Hill is a community of about 50,000. And we are at the southernmost end of the Silicon Valley. So, you know, the big high-tech area. San Jose is the largest city in the Silicon Valley. And actually San Jose is one of the largest cities in our country. We, on the other hand, right next door to them, you know, are rather small for a city. And so I think some of the challenges is because here in California, as I believe in other places, you know, the orders are coming from the county public health departments out to the different cities. And I'm sure this is the case in many other places, but there's been some real variation within our entire county as to, you know, number of cases, the issues. Originally in the South County area, which there's one other city just south of us, we had very low cases. And there was a big pushback within our communities in relation to why do we need to follow the same orders? You know, we're kind of a separate entity, even though we are a part of the larger Santa Clara County. In the end, we've ended up in the city just south of us having a very high case number, particularly in our Latino community. And so that has been a struggle. And we, as the city, are very much in the middle of it all. You know, we can't change the orders. Originally, we were getting a lot of pressure for our elected officials to push back against the public health department and against our public health official to, you know, call out that we were different. We shouldn't have to follow the same orders. And, you know, interestingly, although I'm sure many across the country always have this impression that the entire state of California is very liberal, in our community, we have, I would say, actually many conservatives. And so within a smaller community in California, the issues at the federal level are becoming very real and playing out in the conversations about COVID-19 amongst our neighbors and residents. And it's very challenging to really have solid engagement because we, the city, don't have a lot of clout in this whole situation. And certainly we are not the health experts. We know what our own economy looks like. We know the unique and special needs that our, for instance, downtown businesses have. But I think that's been a very interesting challenge. And certainly in my role as the communications and engagement director, you know, it's been difficult. We can provide input to the county. We encourage our residents to provide input to the county. We can help to facilitate conversations, but ultimately we can't really implement much that's going to make a difference for our direct community.
Yeah, I think that, and that goes back to some of what Brianna was saying. I think that there's kind of two big challenges that I'm hearing here. One is just that piece of most residents may not even know exactly how decisions are being made and at what level, which is state, which is county, which is local. Why aren't there exceptions for this? And particularly when you have different cities around, you know, I know different cities around the state, a city can be more restrictive than the county. So they may say, oh, well, this city's doing this, so why aren't we doing something completely different? So I think that jurisdictional question and how you communicate, that's a communications piece of closing the loop. How do you communicate back to people? We hear your suggestion, we can't do it for this reason. And then I think another piece is that are the competing values. And I want us to be really, I think that, you know, to the extent that there are any safe spaces to talk about this, I'm hoping that ELGL is, really being able to acknowledge, especially as this time goes on, that some of those conversations become very personal. And there's, you know, Maureen, you mentioned the business community. Those are real pain points for many people. And I think a lot of times in our national conversation, it can sort of be couched as, oh, you should be willing to give up a bit of money in order to save lives. And that's kind of as complicated as things, as complex as the dialogue gets. But when you realize there's also conversations about, you know, I know here in California now, assisted living centers and other boarding care facilities have been closed for 5 months. And when you're talking about someone maybe in their 90s who hasn't seen any family members for 5 months, those become very, very personal. Hospitals where there aren't visitors allowed as people are receiving cancer diagnoses, like there are mental health challenges as well as physical health challenges. And I think that that's really tricky in a time where it's difficult to put people in communication with each other because we're all socially distanced as well. So it's one thing to have a comments page up and be getting everyone's feedback, but then how do you kind of contextualize that? And I'm interested in anyone taking a stab at either of those. Either how do you kind of help people understand where the jurisdictional boundaries lie, but also how do you help people engage with the fact that like these are really hard conversations to be having and there really are competing values in this. Jennifer, I saw you unmuted yourself. Do you want to take a first stab?
Sure, I'd be happy to jump in. Texas, I'm coming from Texas and I don't believe Brianna or Maureen are. So as a local county health department, we had more ability and more decision-making power early on in this crisis, and that was taken away by some of the governor's orders. And that really made for a big struggle with our community members, not understanding that or understanding the process or saying, why can't you do this or why can you? For Texas and then for our county specifically compared to our two larger peer counties, Tarrant and Dallas. For Denton County, we are very split between a rural and urban communities. So we have some city centers and we have cities that are much more populous, but I would say at least 1/3 up to 1/2 of our county is farmland and is much more rural. And that's been a difficult juggle in communication, even in mask utilization, when we were in quarantine, when we were isolating at home, seeing those zip code analysis of who's moving and who's not. All of those things have just been such an interesting study for us in public health. From the very beginning, our goal was to be as transparent and as communicative as possible. Part of the role in communications and in public information officer position is to help our community members understand what's going on. And I really work hard personally in my position professionally to relate to our community members. I also live within our community. I'm also a parent within our community who transitioned to parenting from home and teaching from home. And I was also a college student at the when this started in my master's program. So all of those things, I try to put on those lenses or put on those hats when I'm communicating back to our community members. All of them are shifting in feelings, and I think we all have. And I think that's what I really try to do, and what our organization really tries to do, is being as responsive as possible. What does that look like? It doesn't look like just spitting back an answer, but it also looks for the pain or for the hurt, or why are we digging into this question? What's behind wanting to know this question, and helping them understand whether it's a government process, whether it's a public health process, a validation of a death. We don't report a death as soon as the individual passes away. It takes validation and looking for disease progression and all of those things, which is almost a different language. If you're not experienced in public health, or if you're not experienced with epidemiology background, it really does take a bit of translation, so that our community members understand, so that my parents understand, so that my son understands. And I really try to look at it that way. How would I explain this to my parents, or how would I explain this to my son, who don't have that public health background, or don't have that love and desire of local government like I do? How do I help them understand? And that's the way that we've looked at responding to our community members' requests for information, or even just on social media, responding to comments.
Yeah. And I do want to hear from Maureen and Brianna on this as well, but I want to ask you one more question specifically for you, Jennifer, because you've mentioned a couple of times that your goal is really to be transparent, to be communicative. Obviously, I work in public engagement, so I think that's very important. But I also recognize that in times like this, our information can be shifting so quickly, and there can be things that we just, being transparent sort of means we think this is what's happening, but we don't know. And I feel like that adds a whole nother level to transparency. And I'm just wondering if you have any thoughts on what you've learned around that in a constantly shifting reality.
It has been incredibly difficult. Science is one of those areas. Epidemiology is one of those areas where we want to have as high of a confidence level in what we're saying. That we're 99% accurate, or that we're getting as close as possible. And public health is based in that epidemiology and that science. So it has been very difficult from the very beginning. With masks, is that something that we need to order? Is that something we recommend? All of those things have shifted and have continued to grow, and being that coronavirus is a novel disease has been something that we've had to reiterate over and over. Novel meaning new, novel meaning we don't have a background and years of experience and education based on this. Novel meaning science takes time, and experimentation takes time, and research takes time. And we don't have that time to lean back on. We have a lot of community members currently asking about those long-term effects of coronavirus. What does that look like? We don't have long-term yet to rely on. And that's been what's most difficult, and what we continue to try to reiterate and communicate with our community members is when we know more, and when we know more, we will do more and we will share more. When we don't, when we just simply don't have the answer, this is what we can provide until we know more.
Mm-hmm. Maureen, I see you've unmuted yourself.
Yeah, I was just going to add, one of the other interesting challenges is HIPAA requirements. And that's been a real pressure point, I think, in many communities, I'm sure, but definitely in ours, that, well, can't you tell us where the hot spots are? Can't you tell us, have there been more outbreaks in this specific area? That actually played out very interestingly for us, a month and a half ago, in a meeting with our county, a televised regular meeting where the media attends and is right there. Our own public health officer announced a situation in our community at one of our businesses that even the city, did not know about. And so we heard about it from the media. And so did our community at the same time we were learning about it, when we're trying to support the public health department and say, we don't have this information. The public health department doesn't share this information. And then, so those kind of issues then become I think honestly, a question of, well, okay, you say you're being transparent, but obviously you're not. And then trust, you know, and I feel like our role as the city, you know, we hope our community trusts in us, but we're also trying to build trust in the public health department. And that's tricky when you, especially when you have something like that.
I would throw in that in Amherst, we've had very similar situations. You know, particularly early on, community members wanted to know the names and addresses of their neighbors that had COVID so they could avoid that. And, you know, just educating about contact tracing and HIPAA and standards and why we can't give that information. But because of their desire to kind of have an idea of local count, we were able to start reporting local Amherst numbers in our community where we weren't initially. So we were able to kind of pivot and provide the information that we could safely while maintaining the privacy of people who were diagnosed or confirmed with COVID in the community.
Jennifer, how have you been working on that with the cities in your county as the public health department trying to build trust with cities and vice versa, like Maureen said?
My role specifically has definitely transitioned much more to an intergovernmental relations position than it was before. As Maureen stated, we've had local outbreaks in our communities as well, and trying to balance that from a public health perspective, the science side of it, is this a known exposure? Is this a known risk to community members around it? But also trying to balance these are businesses and these are people's professions, but they're also some people's livelihoods, and exposing a business name or exposing, especially in our communities with so many small businesses, that could affect an entire family for years and years and years. And holding on to that information very closely, because it is so personal and it can affect individuals so personally if that were to be released, has been a priority of mine. And when we work with our community, whether it's our elected officials within our cities and towns, or it's the city manager's office, or whoever it is, whether it's communications in the cities and towns within our county, we do try to give them a heads up on any upcoming announcement, anything that's going to shift or change, but still maintaining that information is protected, or it's very, very dear to somebody.
Mm-hmm. So I know, at least here in California, the last probably 4 weeks have felt like quite a roller coaster. In the wake of a kind of soft reopening that also coincided with a lot of public protests, we had fairly major spikes, which now look like they're kind of getting back under control. I saw today that San Diego's numbers are going in the right direction. So our second largest county is kind of heading the way that we want it to. And so now the conversation around reopening is starting to come back. And I think everyone has a little bit of the like, not wanting to just open the floodgates, but also back to some of those really personal things, whether it is the people who've postponed a wedding, or people who are dealing with medical issues, or people who have businesses that haven't been able to reopen or have reopened in only a very limited form, are also looking for ways to get back to life. And so back to something related to normalcy. What are ways that you, whether you're there yet or not, and I realize we may not be right at that point yet, but as you're thinking, even with your teams or with yourself, what are ways that maybe we could do, maybe even a slightly better job than at least California seemed to do last time in having the full conversation with communities and wrestling with that as we move toward beginning to get slightly back to normal? I'm sure if you have a perfect answer for this, you're operating way below your pay grade right now. Like, you should be president probably, but absent a complete response, what are just some thoughts around that?
I'll just say one of the things that we've been doing now through most of this time is having virtual town halls. And Some of them have been topic specific, but a lot of them have just been literally an opportunity to come together as the community in a way that we safely can and just share thoughts and ideas, ask questions. And while I can't say we've come up with any amazing ideas and plans for how we start to reopen, it's definitely been a good dialogue. And I think we've had a good following of people, and people who don't generally come to council meetings, or maybe don't even come to other types of community meetings, because it's been simple to jump on the virtual calls, and many people obviously have had a little more time to do so. And I think that'll be helpful, as we're still far from a true reopening. I mean, we're still all working from home. And in our county, there's still a lot of restrictions. But I think those town halls may start to become a useful platform to, get a little more community input. We've also been dialoguing with our businesses, particularly our downtown businesses, because they've been particularly hit. We've had an unusual number of protests in Morgan Hill, again, for such a small community. And that has really caused huge issues for our businesses. And so I guess it's not a perfect answer at all. And somehow at a much higher level, coordination between the state and the counties and the municipalities, I don't know what that answer is, but that has to somehow improve and be in place, I think, for smooth reopening, because, we experienced very clearly a situation where our businesses, our downtown restaurants all of our restaurants were able to do outdoor dining. We thought within the county thought that we were allowed to do that. And we had the state ABC show up and shut down restaurants in the midst of dining with no forewarning to the county or to our city. And, those are the kinds of things that we need to figure out a solution to, which are a different type of engagement, because they're not really community engagement, they're right. Engagement between government agencies.
Yeah. Maureen, can you tell us just a little bit about the format of your virtual town halls that you've been doing? How have you been, what does a typical one look like? Maybe a non-issue specific one.
Yeah, so we've made them just an hour. And they do start at 5:30, which is earlier than I would typically start a town hall meeting, because so many people in our area have long commutes. But since so many are not commuting, we decided 5:30 to 6:30. We pretty much do keep it to an hour. There's been a few times when we've extended it by another half hour. But we started off with them very wide open. So just like on this, everybody can see each other, and in a meeting format on Zoom versus a webinar format, we quickly had to change it into a webinar format. So you can't see all the participants' faces, which I'm hoping as we go forward, Zoom and other platforms are going to find a way to offer security and still be able to see the faces of everybody. I think the initial meetings where we could see everybody were a little bit more conversational and interactive. But people can ask their questions. They can, virtually raise their hands, and we can unmute them. Then they put things in the chat. And, it's just been a lot of back and forth. And from an engagement perspective, that has been my biggest delight in all of this, is just to see so many community members be on these calls and have a conversation. We have our entire leadership team present every single meeting. So our community has access to the city manager, the police chief, the fire chief, me, our community development assistant city manager, our public services director. I mean, so the whole team is there, and it's simple for the team to jump on. And it's, it's like, when does the community have that much access in normal times? Very rarely. We're pretty accessible, I think, compared to some communities on a regular basis, but to have all of us together and just literally there to answer questions and have a discussion, I think has been pretty amazing.
Yeah, that's great. I want to hear from Brianna and then also Jennifer, but I also want to invite participants, if you have questions, to start just dropping them in chat, and then we can call on you to unmute and ask your question. Or it doesn't even have to be a question, it can be a comment. I work at a university, and so we're usually very careful about, like, please don't use this as your dissertation time, just ask a question. But this is peer sharing, so if you have an idea or something that's worked in your community, please feel free to jump in. So I just want to put that there so people can start thinking, start dropping stuff in the chat box. And then Brianna, why don't we hear a little
Sure.
from you?
Similar to Morgan Hill, maybe a slightly different format. Ever since back in March, we have been holding twice weekly COVID-specific community chats with our town manager, myself, and a rotating special guest public health director was in heavy rotation early on, where we use a webinar Zoom format and invite people to put questions in via Q&A or to come in the room live and ask their questions. And I have to say, we've gotten really good positive feedback, and those were extremely well attended, and we record them and put them all up in a playlist and kind of push them out via socials, use that opportunity to update the community on things, but also solicit feedback. So that's something that we did early on, and it worked very well for us. We're on a brief hiatus right now with that format, but we're looking to start it up again. We've also have a COVID specific hotline and an email address. We started to get, earlier I mentioned we're a university town, a college town, and as that date moved closer where students were supposed to be coming back, our community members started expressing concerns about mask compliance and large gatherings, which is really common when students come back to campus and to town. So we've set that up to be staffed and manned, and people will get a response back to their question or their inquiry directly, and they don't have to worry about where they should send it. It all goes to one place. So those are some of the things that we've been doing right along. What we realized is we have residents who are very highly engaged in our community, but we're hearing from a lot of the same people, and we know that there's people who are missing from the conversation. So we're actually about to launch a couple new things, new applications and solutions that we think will help with this. We are bringing on Bang the Table as a public participation platform to not only work on a COVID specific project site for people to engage and receive updates, but also with workshops and in-person meetings closing, we want to make sure that we can have that robust community input and discussion on other projects as well that are we're no longer able to meet in person, so now we're trying to recreate that participatory environment online. And it still brings us to the point where we have a lot of folks who are digitally unbanked in our community. They used to use the public library to charge their devices, and that's how they would access information online. We can't allow that right now, so we're bringing in some solar powered digital display signs that are going to have updates regarding to COVID. It'll also allow them to charge their device if they choose, and we'll give them timely information. But the real key piece about that is we'll be able to do a quick poll of community members who are on the street at a bus stop waiting, whereas we don't think that they would necessarily be showing up to our other meetings and formats. So we'll be able to quick poll people on the street where they are. And the big thing, which hasn't been announced yet, but mentioned earlier, being host to our flagship university, which is actually an R1 research university, similar to Denton, UNT in Denton. So we have this really amazing, in our backyard, community of highest research capability, and we're going to be launching a collaboration through my office in the town with the National Center for Digital Government, as well as their Computing and Information Sciences Department, to develop and test new strategies for scaling and diversifying public engagement through technology, but with a lens on social inequity that technology can either help or hurt. So we've got some really exciting things starting, and I don't know if they would have been possible without the in a different context. So in a way, there's a little bit of a silver lining for us with the pandemic in terms of engagement and opportunity that we wouldn't normally have had, and that includes funding. I'll try to keep it brief, but we've been able to fund projects through CARES Act money that we weren't able to get off the ground in the past. And from my perspective, I've had these projects in my mind and on my wish list for years, and now I'm getting green lights where I only hit walls before. So I'm hoping to keep that going and leverage all these opportunities to continue the increase in participation and engagement opportunities for our community members.
That's really exciting. You'll have to keep us posted on the digital engagement research. I think that sounds totally fascinating. Any thoughts from you on what it's on, kind of to Maureen's point about there's kind of two pieces here. There's the community engagement and then the intergovernment agency engagement. What has that looked like in Massachusetts? I know Massachusetts has been another hard hit state. How have communications between you and other agencies gone over there?
So we've had a really great experience with the Massachusetts Department of Public Health, as well as our emergency management agency. And in Massachusetts, we have a very strong municipal association that covers all 351 cities and towns in Massachusetts. And it's a really strong advocacy group for cities and towns. And so they've really kind of been a driving force to keep everybody together and informed, and to advocate to the state on behalf of cities and towns, which has been super helpful. And they've really stepped up in light of the pandemic. So at every level, we don't have so much the county level here in Massachusetts. Right. So, the cities and towns have, have their own boards of health that can have some decision-making capabilities, but we've had very strong communication from the governor's office and the public health department, and I'd say we're pretty pleased with how that's been going.
Yeah. Jennifer, you have already spoken a bit to how you're communicating to your cities. What has communication been like the other direction, coming from state to you, or possibly state skipping you directly to, or how has that looked in Texas?
It has been, I would say difficult is probably the best way to say. We have not had a lot of communication or a lot of heads up on any of the communication that we do get from the state. So when we do receive it, it's typically because we're watching either the governor or someone on TV or on live stream. Early on, I was gifted a scribe for some of those live streaming events, so that they were able to watch and just take notes for me, so I could be aware of what's going on two of the live streams while I'm watching something else, or while I'm responding to something else. So that's definitely been difficult, is just staying. Early on, it seemed like the information was flowing very rapidly, and then we've felt some pushback here within the past, I would say, 2 months. And in Texas, we're struggling with COVID. Statewide is not doing so wonderful right now. We've kind of plateaued, and we do hope that we've kind of hit a plateau. And while the number is still uncomfortably high, we're hoping that it doesn't rise anymore. But it has been difficult having little communication coming down, or having very last minute over whether it's new cases that are coming out, or an error in reporting, or was the most recent, there was a backlog in cases that were just recently found because of a computer error, and that's been difficult. Our county our epidemiologists do an excellent job at verifying and completing case interviews with every single case. So when we have a bolus of new cases, we want to verify and ensure that they're not duplicates, and go through that entire process. But a bolus of many cases is difficult to digest through in a rapid amount of time. Mm-hmm. Within our local governments, I think something that I'm most proud of our team and most proud of our leadership team for doing is being available to all of our local governments, to our cities and town halls within our county, also with other local health departments in quick meetings, quick 10-minute meetings of what are you doing on this? What are we going to do on this? But then also even to our local ISDs, as we transition back to school, our independent school districts have been wonderful at having ISD superintendent meetings where they ask public health to come in and give a briefing. And we continue to do that all summer long as we knew we were getting closer to back to school. And this week we had classes start in some of our local school districts. Next week classes will start for some in person and some online. And then within this next month, most will have the opportunity to go in person depending on the public health crisis. So that has definitely been something that I'm proud of our leadership team for doing, proud of us for being able to step into all of those different spaces where we're seeing people that are, as Brianna shared, people that might not be otherwise engaged in public health, whether it's on our social media or something like that. We're finding them in ISD board meetings where they have the ability to do a virtual ISD meeting and speak to our health director, whether it's a small town within our community, the town of 2,000 individuals, or it's a town or a city with over 100,000.
Thank you. We have a couple questions in our chat box. One that I think was sent just to me, so I'll ask that one first since everyone else can't see it. Chris Kiefer was asking, based on your experience, have you found the best time of week and day for virtual town halls? He was noting that one of their council members had a really big turnout on a Saturday at noon teletown hall, but he's interested in what others have found effective. Or if you're still feeling it out. Brianna?
We definitely are still feeling it out, and we've done some kind of polling in the community of what time would you think is best. So recently we've landed on the lunch hour for folks, and for people who are reporting to a more brick and mortar location, that's been kind of the feedback, oh, I can't do that because I'm actually reporting to a workplace, so it's not as convenient. So we've been mixing the lunchtime hour with similar to what I think Maureen's timing is with the after work 5:30 to 6:30 hour. But yeah, it's tough.
Mm-hmm. And of course, nothing's going to work for everyone.
And to get around some of that, I know, people might want to engage live. We've kind of always put a little caveat: if you can't make this one live, send me your comments or your questions directly. We'll make sure we answer them, and then I'll send them the recording with the minute marker that their question was at. And that's been, it's not perfect, but it kind of lets them know that their opinion still counts and that we're thinking, considering their opinions.
Maureen?
We're planning to do a poll of the community, one to see the frequency that they'd like to see these continue, and also to look at different times and days of the week. And of course, that's a constantly changing thing as well, because as different things open up, as more people are returning to work, as people, now the summer is ending, and whatever way people are doing school, that's a whole different situation. With the weekends actually do become maybe a better option because families aren't running around taking their kids to soccer and, all the different things that the weekends used to include, at least certainly out here in our state. So we're still looking and trying to figure that out. One of the things we also do, I forgot to mention, is we live stream our town halls, not just on Facebook, but also through our website. And we also broadcast it on our government access channel. So we're providing as many opportunities as we can for people to see it. And then, like you said, to have the recording.
I think that opportunity too, to recognize that, that it's going to be different for many different people, that you provide as many channels of access as possible. I mean, this was true when we were doing meetings in person. How many people of us have planned a really great workshop and had 5 people show up? Or alternately had 500 people show up. Neither of those is usually a very good sign. But having this ability to test and maybe do a few different things, I think is kind of an opportunity we have here. Another question from Madison is, and then I think we're probably gonna have to start wrapping up, but and maybe I'll ask each of you just for one engagement activity, some of you have mentioned this a little bit, that you've implemented that you want to carry on post-COVID-19.
This is Sarah O'Brien in Smithville. I haven't spoken yet.
Oh, okay. Jump in, Sarah.
Doing basically taking the show on the road. And so we're going into neighborhoods to get feedback and discussion, kind of like a mobile pop-up, design studio or roundtable, whatever you want to call it. And so meeting the people physically where they are. And I think that's something that we will do from here on out.
Awesome. That's great. Yeah, anyone, either our speakers or anyone else on the call, have any things you've started that you want to keep going?
I'd love to hear what some of the things other people have done if they feel like sharing. I've got my notepad ready.
In public health, something that we've done, I'd be happy to share, is we started with a dashboard. Our previous ways to report were pretty PDF oriented, and it was a PDF report that you could download, and that was shared out, in a press release. So we've made a live dashboard that's more interactive, that individuals can click down, since we're a county, they can click down to narrow that to their city or to their town. And within the next week, we'll be introducing a live dashboard for ISDs as well, so where individuals can narrow down to their child's school and know the attendance percentage for that school based on the ISD's reporting. So really just trying to find ways to make the overabundance of data relatable and digestible and understandable to the community members, but also personal to their living situation or their family situation. That's something that we're very proud of, is the dashboard that we've worked so hard on, and something in part of that building the race car during the race. It's something that we've kind of continued to use community member feedback. We want to see a date of death instead of reporting date, or we want to see where the cities and towns compiled in a certain way. They wanted to have a heat map style on our website. So those have all been intricacies that have we've been able to navigate through on that dashboard, and something that we would like to continue in our future reporting is utilizing our GIS services within the county, Esri, and all of those different databases to assist us in reporting as personal as possible while still maintaining privacy and health information.
Serena, I don't know how easy it is for you to unmute where you're at, but it looks like your county has also been doing some mobile engagement station stuff. Is it similar to what Sarah was describing? Is it different? What have you guys been doing?
So ours, hi, I'm Serena.
Hi, Serena.
We've just been identifying opportunities like alongside face covering giveaways, food distribution. So where people are coming out in safe ways to receive some kind of assistance or meet a need, and creating opportunities for people to respond to questions and be a part of the conversation that way. We found a lot of times those folks aren't engaging on the digital platform, or aren't able to schedule in meetings and things like that. So again, it's yeah, just like the other person was saying, it's typically during the day, sometimes on the weekends, but just looking for opportunities where people might already have a task to do outside of their home that makes it easier for them to kind of come and receive information. So we have, tons of different pamphlets and flyers about where testing sites are going to be, or information about how to be safe when they go out to the grocery store and things like that, just as another way of sharing information for particularly the people that don't have access to broadband or email even.
That's great. And I love that. That goes to one of our longtime best practices that we've pushed at Davenport Institute, both for getting information out, but also for getting feedback in, is, I think too often we function on an if we build it, they will come, but they're not going to come because they don't actually know what we're doing most of the time. Particularly, right now, maybe everyone's aware that there is a public health department, but 9 months ago, they may not have even known that. So that idea of connecting with people where they're going to get daily needs met, especially needs that the government is providing for them in one way or another, that's a really, really great opportunity. Well, we're starting to push up against our hour here. I know that as Kirsten mentioned, this will be recorded. And we will also be creating just a very brief kind of summary one sheet that will pull some of the things that have come up in this last conversation in particular, just some ideas and different things. want to remind everyone, I know ELGL has a number of offerings that they're doing, all of which are fabulous, but I want to remind you all that we have 3 more conversations specifically focused on sort of COVID in this moment. Next week, same time, we will be doing a conversation around education, specifically what are school districts and how are school districts and local governments working together in this moment to make decisions and to think of creative solutions to some of the challenges. And then the following week, we will have a conversation with business community, with cities working specifically with business community. I know we got into a bit of that today. There's a lot of overlap here, but really looking at how we're working with business. And then wrapping it up a little bit with just some fun, creative community building and placemaking opportunities that people are finding even in the midst of social distancing. So we will have 3 more each of the next 3 Wednesdays and are very excited to be working with the LGL. Also, if this is I want to do one shameless pitch for Davenport Institute, which is if this conversation has been something that you've enjoyed that's relevant to the work that you're doing, I would encourage you to check out, I'm actually going to drop it in the chat box. The Davenport Institute offers a professional certificate in public engagement for local government. Generally, this is a 3-day in-person in Malibu certificate. I wish we were welcoming you all to Malibu. It's really fun. It's also really expensive. So the advantage is that it's much less expensive to do it virtually online. And we're doing we have 2 virtual cohorts coming up in October. And depending on demand, we'll then continue to offer a virtual professional certificate. So I'm going to drop information about that into the chat box right now and would encourage you to check it out. It's really a great opportunity to learn both from some experts, and we've got a great person in online engagement as well as in racial justice and equity. But also from your peers. So this type of a conversation where you're able to engage with people. Kirsten, I'm gonna turn it over to you for any last minute comments.
Well, thank you so much. And you should, that is not a shameless plug. That is a very worthwhile plug. And ELGL's been proud to share information about the Certificate in Public Engagement program. We think it's absolutely worthwhile, especially, as Ashley said, if you enjoyed today's conversation. So please check that out. I did grab a copy of the chat and we'll include that in our summary post with the recording. I loved how people were sharing ideas about what they're doing, as well as learning from our experts today. So thanks to everyone for participating, and a special thank you to all of our speakers for sharing their wisdom and perspectives about engagement in their communities. And again, as Ashley mentioned, this is the first of a 4-part series on engagement and local government. And so we hope you can tune in for our upcoming editions of this program. Next week is on school districts, and then the chance to then talk about economic development and creative ideas, I think rounds out a really nice education series. So let your friends and coworkers know about it as well. So with that, I'm going to sign off. And again, we'll send you a copy of the recording and the notes. And again, thank you so much for joining us today.